misled in the fight of this pandemic. By individuals protecting themselves, their families, it will go a long way to protect our counties, our country, and contribute to the well-being of our world. And so we are here as governors to participate in disseminating this information and in playing a critical role to make sure that we are safe as individuals, our communities are safe, our country is safe, and our world is safe. Asanteni sana. Thank you.
Thank you, Chairman, and ladies and gentlemen. I think first and foremost, just to echo the sentiments of our chair, we want to appreciate the President for the leadership that he has shown in these circumstances. Secondly, I think when you look at what has happened in other countries, be it in Italy, in China, in South Korea, the next 2 weeks for us as a country are very important. We are on week 2. Next week we'll be on week 3. Then thereafter on week 4. What happened in Italy is that the week 1 we had about like 2 or 3 cases. The second week it rose to about like 10. Third week it went to 300. Fourth week it was in thousands. So we are at a very, very critical stage as a country. It's important that we see what happens going forward, and we must, as a country, align ourselves with the guidelines of the Ministry of Health. Thirdly, and more importantly, what the chairman has mentioned is that we're asking the national government to decentralize the testing, because one of the biggest problems we have seen across the world is that unless we are able to test many people as we can, we will not manage this virus. So I think the national government, as the chairman has mentioned, needs to decentralize this issue of testing so that I think every region has a lab that is able to test and tell us as counties that these are positive or negative or whatever it is. Lastly, I also want to appreciate the President, and I think just to add to what the chairman has mentioned, this morning has had a meeting with the leadership of the banking sector. I think we have, or we must have a meeting with all the stakeholders who run the economy of this country and discuss the economic impact going forward of this virus. This is because it's going to be massive on the economy of this country. Asanteni sana.
Thank you, Chairman. I want to take this opportunity to thank His Excellency the President for his leadership and also the 190 throughout the country. I'll give an example of Embu, where we got 4 residents who have been staying overseas, 3 in UK and 1 in Holland or Netherlands. If it was not because of the alertness of the people in the villages, they would have gone there and invited people all over the place. But we were able to contain the 4 very fast. Unfortunately, we were not able to test them because the testing is centralized. So I reiterate what the chairman has said. We must have testing centers starting with level 5, then level 4s in that order. Number 2, the kits which were distributed, I think they are short in terms of the booths. Instead of 25 booths, we only got 5. It's critical we get the remaining 20 so that our health personnel can do the work they are doing. And I commend them so far. Asante sana.
Asante sana. Nitaongea kwa lugha ya Kiswahili. Ningependa kumshukuru pia Rais wetu Uhuru Kenyatta, amesema kwamba tuvute pamoja kama nchi. Wakati huu sio wakati wa siasa, sio wakati wa kujipendekeza, sio wakati wa kuzunguka na mambo ambayo hayafai, ni wakati wa kulinda watu wetu. Kwa hivyo namuunga mkono rais wetu kusema kwamba tuvute pamoja kama nchi, tukae pamoja, tufikiri pamoja, tufanye kazi ambayo inafaa kabisa. Jambo la pili ni kusema kwamba nchi yetu sio nchi ya matajiri peke yake, ni ya matajiri na maskini. Ni ya matajiri na wale wana pesa na wale wengine wanatafuta pesa. Kwa hivyo tushirikiane na tusaidiane kama nchi. Na tujue kwamba ugonjwa huu ni wa kila mtu, haujui tajiri, haujui maskini, na tuko hapa Kenya, lazima tutibiwe na tuwe na sera ambazo zinafaa. Ndio naunga mkono kabisa vile tumesema kwamba hizi testing centers tuache hii mambo ya centralization ambayo tulikuwa nayo kutoka tupate uhuru, ambao tunaona bado devolution kwanza ijaingia katika mioyo na system ya watu wengine wa national government. We always need to think about to decentralize things. Kwa hivyo tumesema sisi tuko tayari. Kwa mfano Machakos tuko na lab, tuko na all the equipment ready ya kutest coronavirus. Tunangojea tu tukue accredited, tukue approved, and it is the same with other counties. Tuko tayari, we can start testing coronavirus tomorrow. Tunataka ingine ikue western, ingine ikue north, south. We cannot bring everything to Nairobi. Ingine nikimalizia ni kusema ya kwamba pesa ni kitu cha maana sana. We need money. Na president leo amekutana na banking sector, wakaongea about banking fees hapa na pale. Lakini tufikirie, what can the government do, national government, treasury, tusimamishe some projects, tusimamishe mipango ingine, tuweke pesa kando that we can cushion. Kuna biashara zinafungwa, kuna hoteli zinafungwa, kuna factories zinafungwa. How are those factories, how are they going to continue after this pandemic? Zingine zitafifia kabisa, watu watapoteza kazi. Kula Marekani, companies zinapewa pesa kama cushioning, wananchi wanapewa pesa. So we must be involved in a conversation and think outside the box, tuone ya kwamba how to take care of our businesses and our people. Rais wetu pia ameongea kuhusu watu waache hike prices. Ni jambo la maana. Na mimi naomba my colleagues hapa, mimi nikianza Machakos, biashara yoyote ambayo inaongeza prices za normal goods ama normal products zinazotakiwa kwa wakati huu kwa sababu ya coronavirus, tuta revoke license yao mara moja na tutafunga hiyo biashara. Hiyo tamaa yako, utaenda nyumbani bila kitu. Kwa hivyo tujunge maslahi ya wananchi, tuache kufuata pesa wakati mwingine na watu wanaweza kufariki. Kwa hivyo tufanye hivyo. Na mwisho, hii coronavirus ina affect sana wazee. Babu zetu, wazee wetu, wazazi wetu ambao ni wazee, tukiangalia historia kule China, Italy na wengine. Kwa hivyo mimi naomba wazee wetu, akina baba na mama ambao ni zaidi ya miaka 70-75, tukae nyumbani, tusitembelewe na watu wengi. Let's hang around at home. Tusianze kwenda sokoni, kuingia kwa magari na wengine, kwa sababu hao wakiambukizwa, chances zao za kuaga dunia ni haya kuliko za kijana akiambukizwa. Asante.
Thank you very much. On behalf of national government, I want to thank the chairman and the excellencies governors for working very closely with the president and my colleague CS in charge of health, CS Kagwe, in ensuring that we confront this new enemy called Corona. Now, this is an enemy that does not know any borders of any country or any county. That is why we need to work together with all our counties to ensure that we are able to confront this disease. It will take all of us working together, and I want to thank the governors. Many of them have already set up emergency centers in their level 4 and level 5 hospitals in all the counties across the country. This is very necessary in terms of preparedness to confront this, because it can happen anywhere, in any region in our country, in any county. In the US today, we're being told almost all the 50 states are affected. So all our 47 counties must be alert, we must all be vigilant, and we must all work together to ensure that we contain this disease. Thank you very much.
Okay, if you have any question, clarification, I think we have been more detailed on this issue, and we'll keep on briefing you as we move on. Yes?
Chairman, there are some questions that you've raised or inadequacies in terms of equipment and other materials. Is there maybe a budgetary allocation that you have made as governors, first of all, before you get those provisions from the national government? None of the CS is here. He respond on why there is such a delay and what they are doing as government because of collective responsibility.
At the county level, we have emergency funds. There is a provision in the Public Finance Management Act that at least 2% of our budget we set aside for emergency. And I've clearly said, as we approach the end of the financial year, those accounts or that vote, you'll find that it is stipulated. That's why I've requested my colleagues that if the account is stipulated, then they will need to do supplementary or do virement from other accounts. But this being a national disaster, counties cannot cope up. So we will need support definitely from the national government. Unfortunately,
This will be happening every day, giving you every day's update until otherwise directed. And therefore, the Cabinet Secretary will be giving that update, and when he is done, you'll get a chance to ask questions. And please remember to state your name and the media house that you represent. And without any further ado, I would now like to invite the Cabinet Secretary to make the briefing.
Good afternoon, ladies and gentlemen, members of the press, fellow Kenyans. Yesterday afternoon, I gave you an update of the status of coronavirus disease in Kenya, confirming that we had 4 cases as at yesterday. Today, we have received confirmation of another 3 cases of coronavirus. Following tests that were carried out by the National Influenza Center as well as Kameme laboratories in the country. Therefore, we now have in the country 7 confirmed cases. It is very, very important to note that all these cases have been imported cases from outside the country. The first 2 cases related to these 3 that I've just mentioned are a couple that had traveled from Madrid, Spain on the 4th of March 2020 through Dubai, arriving in the country on the 5th of March. The third case among the 3 that I have now mentioned involves a Burundian national who had traveled from Dubai to Kenya, arriving on the 17th of March 2020, and this one was picked by our surveillance team with high temperature during routine screening at the Jomo Kenyatta International Airport. And that establishes, I think, what we have been saying all along. We are able to screen, and we are able to pick, and we are able to determine. So this one was a case in point, an establishment of that fact. So what we are doing now is that tracing of persons who may have come into contact with these patients is now ongoing. 18 cases are currently admitted at Bagathi Isolation Center. 7 others have been screened out and are negative. Samples from the remaining 11 suspected cases are currently being processed in our 2 designated laboratories. The 7 who tested negative are being processed for discharge to continue self-quarantine at home under close supervision of the Ministry of Health staff, collaborating with the country surveillance teams. I want at this juncture to make a special appeal to Kenyans who are traveling from outside the country. It is now clear that the threat that we face, first and foremost, is the threat from Kenyans who are coming from overseas, or Kenyans who have visited overseas countries. And that is why we had said that Kenyans who are coming in must self-quarantine. And we are happy to say that a lot of people have complied. But at this juncture, we also want to appeal to the general public that if you know that an individual who has agreed to self-quarantine and you can see them not self-quarantining, please report them to our toll-free number, 719, and let me remind such people that it is an offense punishable by a jail term for you to say that you are going to self-quarantine and you do not. And effective today, any Kenyan who is traveling from outside the country must sign a legal form at the airport, must sign a legal form to confirm that they are going to self-quarantine themselves, which gives us the instrument to actually jail you if you do not follow the procedure. If you do not, and the public pronounces you as such, and it is proved as such, we will then take you, self-quarantine you forcibly for 14 days, and then charge you in a court of law. We continue to improve our preparedness for the disease. Today, for the first time, via a video conferencing capacity which we have just installed today, our doctors were able to carry out a video conference with Chinese doctors. The ones who have been handling the disease in Wuhan were able today to talk on a one-to-one, not only with the Kenyan doctors, but also with about 20 countries. We were in a video conference, all of us, with 20 African countries. This is an extremely important step in terms of knowledge share, and they gave us tremendous amount of knowledge, which we believe will also go a long way into assisting our people. And when we talk about self-quarantine, at one time, 1.4 billion Chinese were self-quarantining. In Wuhan alone, there was a forcible quarantine of about 60 million people. So let's put things in perspective and tell our citizens that if those people can do it, why can't we infuse discipline within ourselves and do the same? And I appeal to Kenyans to please understand that this is something that we must do. On the issue of social distancing, we continue to emphasize that we do not wish to see any congregations anywhere. We do not want to see people congregating at any point. And this, again, will go a long way into stoppage of contacts that can create the spread of the disease. When we listened to the Chinese advice that they were giving us, they repeated over and over again the issue of washing your hands, the issue of social distancing as the key to why the Chinese infections are coming down at a very fast rate. And they are releasing people now, people who have been on self-quarantine, people who have been on government quarantine. You know, they are slowly beginning to release those people from those areas. And that is because of the discipline that they have exhibited. So, in a nutshell, I don't want to add anything else other than that. That is the current status in the country. As I said, we are looking at the situation as it unfolds. We will be announcing further measures that we want to take. This afternoon, there is, as you know, a meeting in State House, and during that meeting, and after the meetings with the executive committee, with the coronavirus committee, we will probably be announcing a few more measures that we wish to take in order to contain this disease. I want to thank Kenyans those who are obeying, and those who, from the media, especially the media, I really want to thank you again and again for the work that you continue to do to support this effort towards securing our people. Thank you very much.
You can ask question, but just one question per person. Just one.
Let me just respond to that first. You know, I explained yesterday. The fact that you are on self-quarantine does not mean that it is not compulsory. It is compulsory self-quarantine, so to speak. Because what we cannot do is that whenever there is a big outbreak, there is no reason to put you in a hospital, because essentially, that's what you are saying. There is no reason to put you in a hospital if you have a bad cold. If you have got a very bad cold, which is essentially what this one is a severely bad cold. It is not necessary. If you have disciplined yourself, it is not necessary to take you to a forced isolation. We only do that for two reasons. Number one, you have clearly demonstrated that you can't. Or number two, you do not have the environment in which you can do that, in which case we will provide that environment. Now, let me also explain that when you talk about government quarantine, it is not in Bagathi. You know, we are not quarantining you in Bagathi. We are quarantining you in government-designated quarantine areas. For example, from yesterday, we are establishing the MTCs as potential quarantining areas. The MTCs are very suitable for the KMTC. Is very suitable for this purpose. They have got the structure, they have got the doctors, they have got the kitchens. So if we determine that you should be self-quarantined, we can quarantine you, we will take you to an institution such as that one. It is not necessary if you don't have to. On the issue of transport, as you noticed from the other day, our people are training. We continue to train the transport sector to keep sanitized vehicles, to keep sanitizing people, to keep out anybody who is exhibiting any symptoms of the disease. But you are also aware that people are staying home. And because people are staying at home, then the issue of transportation becomes less and less and less necessary. So, but we don't want to stop anybody because people have to go and get some food. People have to go and get provisions for their houses. So up to this time, we have not said that we are stopping completely. Of course, if the situation were to warrant it, then we would have to take that action. But for now, we are saying as long as we can establish that we can safely move people, then we will not stop it for now. Yes, two other questions? As I said, that situation, we will come to that point when the National Emergency Committee has determined. And also, we are not just working on the basis of just ourselves. We have got behind us a very strong team of experts in this area who are modeling. They are carrying out modeling as we speak. Even when we are here, they are still carrying out modelings to tell us they have identified a person here, a person there, a person there, and according to their modeling, this is the likely scenario. So depending on that advice, that is when we take those decisions. Because we must be clear that we don't just take decisions on the basis of a feeling, you know, that Mutahi Kagwe has a feeling. No. We do it empirically so that we take decisions that are based on facts and figures. So let me clarify that. Let me first of all say, we have already sent to each county the initial kits that were crucial for any emergency. We sent 25 kits to every county, each county. And from tomorrow, we are now going to be dispatching everything else in accordance with the requests of the counties. Now, let us not forget that because of global shortages of these items, we have to keep on searching for them. And the good fortune is that we have not run out of anything yet. And thanks to the Kenyan business acumen, they are also bringing in some of the approved items by WTO. Now, let me also add this. As far as the hand sanitizers are concerned, we have infused a system in Kemri, working with sugar companies such as Mohoroni, who are the ones who produce ethanol. We are working to flood the market with hand sanitizers. So those, as I said yesterday, one of the ways of resolving any overpricing of anything is basically increasing supply. So we are going to increase supply to the extent that that business may not actually be very viable after a while. Thank you all very much. Okay, one more. As I said yesterday again, and I want to repeat this, when you meet the case definition, it makes sense to test you. But if you tested each and every person in Kenya who walked in and wanted a test, first of all, if you don't even have a temperature and you are not showing any sign of anything, then why would I test? I haven't tested because I haven't developed any symptom. But if I did, I would want to test. And when they test, then it is not chargeable. There is no charge on that on the test. Let me just clear that. And we are improving on our capacity to charge. Final one then. I'll let the DG respond to that.
Thank you, Waziri. Yes, indeed, there was a patient who was in Bagadi and apparently left the facility. And through the security apparatus in the country, we were able to trace the patient to wherever she was, and we brought her back into Bagadi and tested. Of course, it was positive, and we have traced the contacts of this particular patient. As at now, we are following 85 contacts actively, and we'll be giving you updates on the outcome of the contacts that we are following. Thank you.
Thank you very much. Thank you.
We'll give you further updates and we'll be able to tell you when. Thank you so much.